Hello, I'm Jordan Hibbert and I'm currently in my fourth year of health studies and I'm doing my fieldwork at the Pasqua Hospital Accountable Care Units. So hospitals have never been really designed for the complexity of patient care as acuity, pressures, expectations, and competing responsibilities are ongoing issues. So the Accountable Care Units kind of fixes those issues as the form of healthcare uses a team-based approach to patient care. Physicians, pharmacists, nurses, and allied health are assigned to a primary unit where they perform structured interdisciplinary bedside rounds. And as a team member of the Quality Improvement Department, my role was to discover the areas where performance was lacking and incorporate measures in order to improve performance on a unit-specific level. And so my project was about revisiting the relational covenants on 4B to find out the staff members' beliefs of what an ideal unit is, to find the morale, and to see if the staff are currently manifesting the current statements. And this project was actually a qualitative research design called a focus group, in which I learned that in Health Studies 400. And so I conducted the interviews, and they were all anonymous, and they took place daily for 2 weeks as I followed a standard script. I then analyzed the responses by transcribing and theming. And so the main objective from the project is to take what the staff said during the interviews, find common talking themes, and discuss further actions to improve the unit as a whole. And there were no proposed outcomes except getting the staff to sign the covenant, as I had no idea how the staff thought of their unit. And so I created a milestone chart that helped me develop specific timelines of my progress from start to finish. The whole project was approximately 3 months long, starting September 24th and ending December 31st, right before the new year. So one of the outcomes resulting from the interviews was that around half the staff members thought the morale was good, while the other half thought it was declining or poor. And the reason behind the poor morale is because of common themes such as COVID or the short staffing issue with nurses. And this creates exhaustion with the nurses, and other disciplines like doctors, they can notice the disgruntled nurses. But there were positive outcomes coming from the project, such as suggestions from staff to improve the morale and knowing that almost 100% of the staff are feeling respected and valued at work. And so the most shocking part of the interviews and analyzing the transcriptions is that there were staff members that felt that they were neglected on the units and that they wish they never had the position at the hospital. And so a few adjustments I made during my project was that I initially did not have an online survey for the staff to complete who could not get interviewed in person, but because I created one, I got 6 more responses, which improved my sample size. And this project has a lot of value for the staff members because they truly want change for a better unit. The staff did not want to do the interviews unless change was going to be made. And to ensure that, I put up the start, stop, continue chart on the unit's board to help express their beliefs of what needs to happen on their unit. And the quality improvement team wants to take my raw data and the outcomes from my project to have the next university student continue on with the improvement of the morale on 4B. And before the new year, the staff members will sign the covenant to start the new year on the right note. This project was successful and I've developed so many skills, including communication and leadership skills. But I think the most valuable aspect I've gained from this project was developing my project managing skills because I completed this whole project on my own.